Hello, everyone. It's an honor to have this opportunity to present to you on the topic of sensory-enhanced yoga for self-regulation and trauma healing from Iraq to Ukraine. I'm Lynn Stoller, an occupational therapist, certified yoga therapist, and the founder of the Sensory-Enhanced Yoga Institute based in the US. The Institute trains licensed health professionals, yoga instructors, and yoga therapists in the evidence-informed practices of sensory-enhanced yoga, and also directly serves traumatized and highly stressed populations with a special focus on combat veterans, victims of sexual trauma and/or domestic violence, and children suffering from trauma, high anxiety, and/or toxic stress. Our program, Sensory Enhanced Yoga, is especially informed by the highly successful treatment protocol used in the Iraq yoga study, which I co-developed. And our program is also largely based on the thoroughly researched book, Sensory Enhanced Yoga for Self-Regulation and Trauma Healing. Here are the Ukraine faculty. Marika Paquin specializes in mental health occupational therapy and sensory-enhanced yoga consultation in Ukraine, focusing on treating PTSD in veterans. Several years ago, she introduced sensory-enhanced yoga to Ukrainian health professionals and led sensory-enhanced yoga sessions for Ukrainian veterans and their spouses in residential group treatment programs within the country. Our Ukrainian program coordinator, Marina Hrudi, plays a pivotal role in promoting our program across Ukraine. She diligently organizes and coordinates logistical aspects of our workshops for Ukrainian healthcare professionals and also serves as our language translator during these workshops. We are incredibly fortunate to have these remarkable women as ambassadors for our program. In this talk, I'll explore why yoga is one of the most effective adjunct treatments for PTSD. I'll then introduce the Iraq yoga study and provide a brief overview of the transdisciplinary model for post-traumatic growth, which I developed to explain the positive outcomes of the study. This model integrates theoretical constructs and research findings from occupational therapy, trauma psychology, neurobiology, and yoga therapy. Finally, I'll discuss the work of the Sensory Enhanced Yoga Institute in Ukraine. A global study conducted in 2016 across 24 countries revealed that Ukraine had the highest rate of traumatic experiences among its population, with 85% having endured such events. Following the 2022 Russian invasion, a large survey found that over 50% of Ukrainians met the criteria for a PTSD diagnosis. Shortly after the 2022 invasion, therapists at Forest Glade Veterans Mental Health Hospital recognized the urgent need for trauma intervention. They approached the Sensory Enhanced Yoga Institute seeking training, as both clients and therapists were deeply affected by the war, and traditional talk therapy wasn't yet feasible. Self-regulation was paramount. By the year's end, we had trained 26 mental health professionals, with an additional 45 graduating the following year. The impact was tangible. Sensory-enhanced yoga groups quickly became the most sought-after group therapy sessions at Forest Glade. We believe our program is effective because it directly addresses core symptoms of PTSD. As a quick review, these symptoms include re-experiencing the trauma, avoiding reminders of the trauma, numbing symptoms, often indicative of dissociation, and chronic hyperarousal of the nervous system. Numbing symptoms often manifest as a perceived detachment from one's emotions or even from one's body. Since emotions are experienced through various bodily sensations, organs, and systems, Detachment from emotions necessarily involves detachment from the body. Hyperarousal is a heightened state of anxiety and may present as difficulty falling or staying asleep, irritability or outbursts of anger, difficulty concentrating, hypervigilance, and or exaggerated startle reflex. Of the four symptom clusters, hyperarousal is considered to be the core symptom of PTSD, and impaired sensory processing plays an important role in the hyperarousal symptoms. Hyperarousal is adaptive in the face of threat, but if the stress response is not successfully resolved, it leads to chemical changes in the brain, which produce disturbances in sensory processing. To explore war-related sensory processing symptoms, I co-conducted a 2008 pilot study with 12 older combat veterans diagnosed with PTSD. They completed the adolescent adult sensory profile in a custom cover sheet for optional comments. The results were strikingly similar between the individuals, and as a whole, this group showed significantly higher sensory sensitivity, sensory avoidance, and low registration, and lower sensory-seeking behaviors compared to the normative population. In terms of sensory sensitivity, they became dizzy easily, feared heights and movement, were sensitive to background noise, and startled easily. Their sensory avoidance included avoiding crowds and noisy settings, and many kept the shades down at home. They exhibited low registration of stimuli, mostly related to decreased bodily awareness and sensation, as well as impaired language processing. According to polyvagal theory, many trauma survivors are tuned into the sounds of threat at the expense of language processing. One veteran, who scored at the extreme end ranges of the sensory processing pattern just described, wrote, "I endure most of life." Sensory processing issues are very important to consider with veterans and others struggling with trauma, as they have an enormous impact on quality of life. In order to address the sensory symptoms, we need to address the hyperarousal. To do that, we need to rebalance the autonomic nervous system and also especially the hypothalamic pituitary adrenal axis. The HPA axis controls the fight-flight response. Normally, in response to stress, the hypothalamus releases corticotropin-releasing hormone, causing the pituitary to release ACTH into the bloodstream. ACTH prompts the adrenal glands to release cortisol into the bloodstream, which provides the energy to fight or flee. The cortisol also feeds back to the brain to turn off the response once the threat has passed. However, in PTSD, this negative feedback loop fails, causing corticotropin-releasing hormone, which is itself a form of cortisol, to build up in the brain. Normally, GABA, an inhibitory neurotransmitter, helps to keep the HPA axis in balance. There are typically large stores of GABA around the hypothalamus, as well as large stores in the thalamus, medial prefrontal cortex, and hippocampus, which normally provide top-down control to the hypothalamus. You can think of GABA as being big stop signs at the junctions of neurons, keeping them from firing. In an unresolved stress response, all of that extra corticotropin-releasing hormone in the brain overpowers GABA, opening the gates at the neuronal level, causing neurons to fire, communicating a sense of alarm, and thus reinforcing the release of even more corticotropin-releasing hormone. The first major brain structures that were shown to be affected by PTSD are the amygdala and the very structures that normally keep the amygdala in check with their large stores of GABA. Scientists have found alterations in the size, volume, and activity levels of these brain structures, which reflect this GABA imbalance and related chemistry changes. Specifically, in the hyperaroused subtype of PTSD, the amygdala is much more activated, while these other structures, the thalamus, the medial prefrontal cortex, and the hippocampus, become less active. In striking contrast to the PTSD studies, various neuroimaging studies on the effects of mindfulness practices have shown the complete opposite brain activation pattern of PTSD. This makes perfect sense, as those who have PTSD are stuck in the there and then, while mindfulness-based practices draw people back into their bodies to the present moment in the here and now. The majority of these mindfulness studies included at least some yoga, and the vast majority included body sensing and breath work. On this slide, the right blue arrows show the direction of activation in PTSD, while the left red arrows show the direction of activation in mindfulness-based practices, according to numerous studies, which you'll find listed in table 4.2 of my book. With the exception of the thalamus, changes in gray matter volume have also been seen in the direction of activation. The diagram is very simplified and doesn't cover all factors or all brain structures affected by PTSD, or even touch on the network changes that occur. Nonetheless, it still underscores the significant potential of mindfulness interventions for PTSD treatment. A major effect of yoga-based practices is that they increase GABA, the brain's most common inhibitory neurotransmitter. Dr. Chris Streeter and colleagues have conducted several studies on yoga's effect on GABA levels. In 2007, a 60-minute yoga session increased brain GABA by 27% compared to baseline, with no change in the control group. In 2010, 60 minutes of yoga 3 times a week for 12 weeks resulted in improved mood and reduced anxiety, which were positively associated with thalamic GABA levels. In 2018, they compared 2 of their previous studies and found that GABA levels increased to normal in the major depressive group, which also were associated with reduced symptoms of anxiety and depression. And in 2020, 90 minutes of Iyengar yoga and coherent breathing plus homework reduced depression and increased GABA levels in participants diagnosed with major depressive disorder. However, the GABA increases were no longer observed 8 days after that yoga study, after the yoga intervention, suggesting that at least 1 yoga intervention a week may be necessary to maintain the elevated levels. To explain their findings, Streeter and her colleagues theorized that yoga helps to correct imbalances in the autonomic nervous system, the HPA axis, and the GABA system, which often underlie stress-related medical conditions such as epilepsy, depression, PTSD, and chronic pain. In fact, a large body of research has now made clear that the road back to the here and now runs through the body. As Dr. Bessel van der Kolk and many other trauma experts often state, trauma is held in all cells of the body and must be released by the body for complete healing to occur. Meditation techniques that focus on attention through top-down cortical control without addressing the body are often too difficult and emotionally overwhelming for those with PTSD. Yoga, or another appropriate mind-body modality, is often a necessary stepping stone to help individuals move away from their intrusive thoughts and reconnect with their bodies in the present moment. We also have evidence that a sensory-enhanced yoga program can reduce symptoms of combat stress, which raises the question of whether it might also help to prevent the development of PTSD. Only one U.S. yoga study was conducted in a combat zone during Operation Iraqi Freedom, and it turned out to be a highly successful one. The Iraq yoga study, of which I was the associate investigator, was a randomized controlled study of 70 active duty military personnel deployed to Kirkuk. 35 were in the treatment group and 35 were in the control group. The 35 subjects in the treatment group were required to attend a minimum of 9 yoga classes within a 3-week period. Most of them attended far more frequently because they found it very helpful. The classes were taught by the principal investigator, Major John Gruhl, who is a certified yoga instructor. The treatment protocol was designed to provide a therapeutic threshold of carefully selected input, breathing techniques that promote calming, and a series of postures to balance the nervous system. The Iraq yoga study also included certain top-down elements, including positive affirmations. Here, I arranged some of the findings of the Iraq study under the 4 symptom clusters of PTSD. The treatment group showed significantly decreased state and trait anxiety as compared to the control group, as well as reduced sleep difficulties, reduced irritability and outbursts of anger, and fewer intrusive thoughts or images, among other results. On the optional written comments, 54% reported sleep improvements, 37% reported that they felt more calm or relaxed, 26% reported other physical benefits, and 11% reported reduced frustration or anger or better anger management. I designed the transdisciplinary model for post-traumatic growth to explain the likely reasons for the program's success and its treatment implications. This model naturally aligns with the ancient yogic kosha model, which describes the 5 layers of one's being: the physical layer of our body, the energy layer, largely controlled by the autonomic nervous system, the emotional and mental layer, the wisdom layer, and the bliss layer, which we refer to as the layer of integration. The fact that I could easily list the kosha titles above each column after developing the model and without changing a single word of the model shows that much of the perceived discrepancy between Eastern philosophy and Western science is simply due to a language barrier. Western science is rapidly validating what ancient yogis have theorized all along. The first white column explains what happens in PTSD and is a downward spiral that impairs occupational performance. The colored columns represent progressive phases of healing. The goal of each phase is listed at the top of the column, and under the goals are the methods for achieving it. I'll state the model to you now, progressing column by column. To facilitate healing in PTSD, it's essential to assist individuals in safely reconnecting with their bodies, known as the Annamaya Kosha. This involves helping them to self-regulate, which can be achieved through carefully selected sensory input and breathing techniques aimed at rebalancing the autonomic nervous system and releasing trauma-based muscular tension. These techniques must be provided within a safe container, a term used to describe the environmental qualities of the setting and the interpersonal relationship between therapist and client. We can't guarantee absolute safety for our clients, but we can often control at least some of the variables that influence it. By safely increasing awareness and tolerance of bodily sensation and movement, one begins to safely reconnect bodily sensation and emotion at the level of the manomaya kosha, the mental emotional body. This helps to develop the emotional and mental flexibility to more effectively adapt to social and environmental demands. Focusing on and integrating sensation, movement, and breath in present moment awareness promotes an embodied state of being, free from worries over the future and ruminations over the past. The more time spent in the here and now, the better one can mindfully attend to daily living tasks, and the more value those tasks will hold for the individual. Through this process, the mind becomes more open to new perspectives at the level of the Vijnanamaya kosha, or wisdom layer of our being. New beliefs and attitudes more easily take hold when we first prepare the body to receive and accept them. If we're tight with anxiety, or if we're slumped in a depression, we are literally not in any position to receive the insightful advice of a therapist. Talk therapies may thus be more effective when paired with yoga, and combining top-down and bottom-up approaches such as within yoga, such as through sensory enhanced yoga, can be especially therapeutic. Reframing negative thinking patterns into a more positive outlook helps to promote a sense of self-empowerment, which is associated with the bliss body, or Anandamaya kosha. It is by working through these other layers that we achieve an optimal sense of well-being and an optimal sense of well-doing, as the two go hand in hand. This can be further promoted through a variety of purposeful activities congruent with personal interests and valued goals. So this is where we help our clients take the healing off the mat and into the world to enable them to assume a fully engaged life in society. That was just a very brief introduction. You have a copy of this in your handouts, and I welcome any questions about it at the end of this presentation or by email. We developed the Wellness Survey for Post-Traumatic Growth as an intake tool to facilitate implementation of the transdisciplinary model for post-traumatic growth. The columns correspond to the 5 kosha layers. In a nutshell, it answers the following questions about the individual. At the physical layer, do they feel safe in their body? At the energy layer, do they feel calm? At the mental emotional layer, do they feel clear, or is their mind flooded with intrusive thoughts, ruminations, and worries? Are they stuck in the past, or are they feeling present and engaged in life? At the wisdom layer, can they stand back from the trees and see the whole forest? Do they feel uplifted? And at the highest level of integration, do they feel in control and empowered in their life? The Wellness Survey not only identifies the client's current level of healing, but also identifies their interests, goals, as well as resources that you can use to help them tap into to take their healing and sense of self-empowerment off the mat and into their daily lives. Once we identify the challenges and resources using the Wellness Survey, we refer to the relevant columns of the transdisciplinary model for post-traumatic growth, shown at the bottom of the slide, to inform the treatment plan. Our guidelines to practice go into much depth with regard to implementation. I'll provide an example now of how the wellness survey was used in the context of group PTSD treatment in Ukraine. The wellness survey for post-traumatic growth was used to inform the intervention process for the sensory-enhanced yoga component of two 11-day residential PTSD treatment retreats presented in 2019 in Ukraine. Each retreat included approximately 9 couples consisting of male veterans and active military members and their female spouses. The program was developed and led by Dr. Irina Olashko, who had been conducting the retreat since 2015. She had more recently asked our faculty member, Marika Paquin, to start a yoga component consisting of daily morning sensory-enhanced yoga sessions. The retreat included several top-down program components, such as psychoeducation and group process, with trauma release exercises constituting the main bottom-up practice until sensory-enhanced yoga was added to the curriculum. Standardized tools were used to measure PTSD, anxiety, and depression at baseline and again at the end of the 11 days. Both the men and women showed a significant reduction in all 3 measures. Though this study did not isolate out sensory-enhanced yoga, it does illustrate how integrating bottom-up and top-down practices can effectively decrease symptoms of PTSD, anxiety, and depression. Here are the combined results from the 2 groups Marika worked with. Concerning responses are color-coded: blue for men, pink for women, and maroon for both genders. And I'm sorry it's so stereotypical. An item is considered concerning if 25% or more of men, women, or both answered never, really, or sometimes. You can see here on page 1 that this group as a whole was not feeling safe or secure in the physical layer of their being. In the energy layer, many were certainly not feeling calm. So then if you look over here at the transdisciplinary model, this is that first healing column. You see the strategies for addressing this in a nutshell, which of course emphasize rebalancing the autonomic nervous system. On page 2, we find that many participants were experiencing intrusive thoughts, were over-identifying with their difficult emotions, and having difficulty looking at things with more equanimity and cool-headedness. Marika shared the survey results with the group, which they found fascinating. It was intriguing for them to see how many people were experiencing similar problems. The exercise served as a valuable normalization tool, fostering greater understanding among the couples and strengthening the bond within the group. There was also significant discussion and understanding on how sensory-enhanced yoga could impact these issues, how important it is to address PTSD at the body level, and how that would influence all the other layers of their being. Talk therapy was not a preference for them, but they understood how attending to the physical body and the energy body could help prepare them to look at their PTSD, anxiety, and/or depression in talk therapy. The integration page presents resources that can be used outside of yoga. In this group, it was revealed that nature, humor, hobbies, and interests were relatively accessible resources for them, which could further facilitate their healing. And these were highlighted in yellow. Hopefully, this discussion gives you a beginning idea of how integrating sensory-enhanced yoga into treatment protocols and community groups for Ukrainian soldiers, veterans, and civilians can promote self-regulation, healing, and a sense of self-empowerment for all those impacted by the Russian invasion. We look forward to presenting more workshops for Ukrainian health professionals and yoga teachers in our planning research studies. Also, our brand new book, Sensory Enhanced Yoga for Children and Adolescents, Healing Childhood Trauma, Anxiety, and Stress Through the Koshas, was just published last week, and we hope to share the program with Ukrainian school teachers and pediatric mental health professionals. So I hope you'll help us spread the word about that. I welcome any questions that you may have about this presentation and remind you that you have handouts and including references for this presentation. Thank you.